last year, around this time, I was working on a video essay. And of course, that video essay never materialized. Now, I finished the essay itself, the research portion, the writing portion, all of that has been done. All that was done ages ago. But the editor who was supposed to be working on that essay for me didn't. And then another editor was supposed to work on that for me, and then they also didn't. And K-Fox said that, yeah, maybe she'll make it a thing that she'll do in the background, maybe. And I don't even want her touching it in the form that it was in before. Instead, I think I just kind of want to go over the points from the essay itself as its own video. And I kind of just want to put it on the live channel, I think, because despite it being a pertinent talking point, it is something that I made a year ago. There are some things that are out of date in that essay now. I mean, hell, I wrote this before the United Healthcare CEO was killed. So there are some conversations to be had about parts of this essay that are not fully up to date. But I feel like enough of it may still be pertinent. So I'm going to go ahead and just begin with what I had. Hey, if you've ever dealt with healthcare in the United States, you've probably asked yourself a question: why the hell is this whole system broken? Well, today I'm going to do a dive into the medical industry and see what makes it tick, determine whether it's actually trying to help care for people in the US or effectively just trying to kill us. I have a sneaking suspicion that you already know my take before we get into things based on the titling of the video, but we'll see. But first, I want to go ahead and take you to a TV show. Walter White is an underpaid chemistry teacher living in Albuquerque, New Mexico. He's just received life-altering news. He's got stage 3 lung cancer, and all at once he realizes that not only will he have to struggle with his painful cancer treatment, as the sting of $90,000 bills loom over his every move, but for all it's worth, that might not even save him. He's unable to guarantee his or his family's future, and so he turns to a life of crime. And if you've ever seen Breaking Bad, then you know where it leads him. But hold on, Breaking Bad's a critically acclaimed television show, one that shows the heart-wrenching struggle of an average member of our mundane society having to turn to a life of violent crime in order to afford medicine. Well, this is sort of an absurd premise that would only work if you first accept that Walter White is living in a medical dystopia, but Breaking Bad is a contemporary nightmare scenario based on real-life circumstances that anyone could find themselves in. Though my guess is if it happened to any of us, it wouldn't go down anywhere near as spectacularly. I doubt any of us are going to be throwing pizzas on roofs, and I doubt any of us are going to be spending any time trying to hide a body in a vat of acid held in a tub that cannot hold it. I also doubt that, like Walter, any of us are geniuses with plot armor. So, hold on, you're telling me that we have a critically acclaimed TV series that, in short, is about an everyday member of society having to turn to a life of violent crime in order to afford medicine. Does anybody in this crazy country realize this TV show only works if you accept that Walter White lives in a dystopia called the United fucking States? Jesus fucking Christ! Now, audiences may watch Breaking Bad for the spectacle, but I would be willing to bet that they also watch it a little bit, hoping to never end up in Walter White's shoes. But today, I'm going to ask the same question that that show does: what exactly is the worth of a human life? No, I'm kidding. I'm not actually a moral philosopher. I can't ask that very well. So instead, I'm going to be asking this: what is the worth of a human life to the American medical care system? Let's take a trip to the ups and downs of the U.S. healthcare system and see exactly why a country that fancies itself a superpower that is able to drop bombs on other fucking countries ends up treating its citizens like it's a second world country without the means to provide for any of its inhabitants. The worth of a human life, the worth of human experience, really should tip the scales depending on who you ask. Number crunching statisticians may already have an answer ready to go based on the cost of healthcare, food, and other resources. Philosophers may argue based on a variety of ethical frameworks, deterministic value of human life, and other very unquantifiable measures. Healthcare professionals might understand that value entirely differently as a result of limited resources and time, having to narrow their focus to timely decisions where fate rests in their hands, and triage is a reality that they have to deal with every day. Me? Well, I have an answer. And you might not agree with it, but we'll save that for later. So for now, let's go back to how we got here in the first place. Back in the 17th century, medicine, as we know it, was incredibly different. Whereas today, if you're sick, you might contemplate how much you do or don't need a vital organ versus, say, a mortgage payment. Back in the 1600s, we believed that many medical ailments were caused by an imbalance of four humors. You know, liquid parts of the body. Even if this is technically untrue, we actually use a light version of this concept in a lot of media today. If you've ever seen Teenage Mutant Ninja Turtles, I hate to tell you this, but they are based off of the four humors, with blood, or the sanguine humor, representing Raphael, and then, of course, the yellow bile representing Michelangelo, black bile representing Leonardo, and phlegm representing Donatello. Oh, by the way, this also works with Scooby-Doo. Sanguine blood is Daphne Blake, your yellow bile is Velma, black bile is Fred, and the phlegm, instead of being Donatello, is actually Shaggy and Scooby. It really gets really frustrating when you start realizing this is a dynamic of many group shows. Specifically, now, this was because each of the four humors could represent a personality trait, and all of these traits needed to be in balance for a team to handle whatever villain of the week they needed to do. This was an evolution of previous, far more mystical explanations of ailments, thanks in part to Hippocrates writing on the sacred disease, where he said, and I quote, "This shit doesn't look divine, and we can cure it without the gods, so what the fuck is divine about ailments?" And, well, like with our own media landscape, some parts of our culture never got over the God makes diseases style of rhetoric.
Look, we could have an AIDS-free world by Christmas. Here's what the Bible says, Leviticus 20:13. If a man also lie with mankind, as he lieth with the woman, okay, it says, even both of them have committed an abomination. They shall surely be put to death, their blood shall be upon them. And that, my friend, is the cure for AIDS. It was right there in the Bible all along. Because if you executed the homos like God recommends, you wouldn't have all this AIDS running rampant. So
if any parts of this seem kind of weird, it's because there are notes in my actual writing in here, my 46 pages of this essay. Jesus fucking Christ, what is wrong with me? In this 46-page essay, I have notes for sources and videos and all kinds of stuff that were supposed to be going in at any point during the editing. But that was Steven Anderson saying that we could have an AIDS-free United States if we just killed all the gay people, because assuredly AIDS is just a punishment on the US for allowing the gays to exist. So, one of the prevailing texts that we need to talk about next was one of the ones that was meant to keep knowledge on how to bleed people alive in an attempt to cure gout. This text was called, and I quote, this is the actual name of the text, The English Physician Enlarged. Sorry. I need to tell you the actual full title of the book. It is The English Physician Enlarged, with 369 medicines made of English herbs that were not in any impression until this, being an astrological physical discourse of the vulgar herbs of this nation, containing a complete method of physique whereby a man may preserve his body in health or cure himself being sick for 3d charge with such things only as grown in England, they being the most fit for English bodies. Herein is shown upon these 7 things: the way of making plasters, ointments, oils, poultices, syrups, doctrines, juleps, or waters of all sorts of physical herbs, the way of mixing medicines according to cause and mixture of the disease and the part of the body afflicted, by Nish Culper, a student in physics and astrology, living in Spitalfields. Anyway, I get really fucking angry whenever I see the title of an isekai, And that is all that is. It's such an easy to read and understandable title. Anyway, the text contained some knowledge that is still used to this day, like how duck's meat actually has inflammatory or anti-inflammatory properties. Dill weed can be good for the brain, but whereas nowadays we'd say that dill is a good source of manganese, which is needed in very small amounts. It is an essential mineral that supports normal functioning of your brain and nervous system and metabolism of sugar and fat. The English physician instead says, and I quote, "Mercury hath dominion of the plant, and therefore, to be sure it strengthens the brain, the dill being boiled and drunk is good to ease swellings and pains." Because a planet has influence over a weed, and that makes you smarterer. There was also a prevailing idea that herbs and compounds made in England were better medicinally for English bodies. This idea was harshly debunked by the local flora and fauna and diseases that were unfamiliar to Englishmen when they began to suffer diseases they had no names for and didn't have any remedies for in their precious book when they came to the, quote, New World that some of you might be standing in. It's called America right now. They didn't have information on how to combat any of these newfound threats to their bodies. And unfortunately, even effective Native American medicine was denounced for a long while if it didn't adhere to the humor theory. Because the only real medicine is that is made in jolly good England. Am I right? Anyway, these have smallpox blankets. These guys have smallpox blankets. I'm sure no one will disagree with any of their actions in the future. At all. Not even a little bit. While the U.S. did have hospitals established as early as 1722, the first official medical society was actually formed in Boston in 1735 because we realized that sailors could carry plenty of diseases from across the pond, and we needed infrastructure to quarantine them as well as protect our own citizens when they came in contact with said sailors. We then established colleges in Philadelphia and New York to train these physicians instead of importing them from England. A system that would get completely destroyed in the modern day as American citizens can no longer afford college and afford things like medical degrees. Did you know we actually have to import 1 in 5 of all of our physicians from other countries? Because in other countries, they can actually afford the education to become fucking physicians and they can't here? That's so great and cool, isn't it? Anyway, before 1870, hospitals were these low-budget institutions frequented by the chronically ill. Most doctors came to your house if you were ill, but they really couldn't do much besides blow smoke up your ass, which was a thing we did then too. Now, technically, there are some things that we can use that for that actually do help, but again, like with the humor thing, we just did this a little more willy-nilly back then. We had only just established the field of bacteriology, and only a few days later we would realize that blood pressure was a thing at all. And then after another decade, we learned how to x-ray patients to check on broken bones. So yeah, things moved pretty quickly. By 1920, through a few breakthroughs were becoming normalized, drugs that targeted diseases and surgeries were becoming common practice. It was 100 years ago that cutting people open to get rid of things like appendixes was a thing that we actually did more often and didn't freak the fuck out about. Thus, most in-hospital care was to be provided for those who needed it. But from 1990 to 1910, the membership of the American Medical Association, or the AMA, increased from 8,000 to 70,000. Medical infrastructure, as we understand it, started coming into its own. We didn't have something important yet, though. We didn't have health insurance. That concept didn't make much sense to damn near anybody at that point. Not only that, in 1913, the American College of Surgeons was founded and began forcing stricter standards on hospitals by accrediting them. You know, the way we do colleges today. Now, the doctors and hospitals both had stricter standards with pseudo-governmental bodies keeping them in check, and as we all know, the more hands you get involved on a project, the more money it will begin to cost. So, the United States Bureau of Labor Statistics has calculated that hospital costs were 7.6% of a family's total bills. And by 1929, that had risen to 13% of a family's total bills. You know, during the roaring 20s. Almost as if we started establishing a pattern that would make things go really, really bad. Hey guys, the Great Depression happened in 1934. Now suddenly medical bills are 40% of a family's given income. This is where we started creating prepaid service plans to try and provide an affordable way for customers to pay for hospital care. In reality, these were made to keep hospitals afloat and, not dying financially because our government liked paying for guns more than the healthcare of its own people. So here's where you start getting the general idea of the modern day insurance plan. So if I tell you that insurance plans, as we understand them, are a Great Depression profit-making scheme that we kept going into the future because we're the United States, why the hell wouldn't we keep a bad idea? Would you believe me? Because that's what we did. That's exactly what the fuck we did. By 1937, there were many of these new prepaid plans, with over 600,000 members across the United States. Eventually, these all got grouped under the Blue Cross network of plans, which is a name most of you should be familiar with by now, since they had to pay over $2 billion in class action lawsuits for not paying for care that they were supposed to. Blue Cross would start as a non-profit, which technically meant that there were fewer government regulations that would be imposed on them. As another fantastic idea. This would begin what we would fully understand as the modern United States medical system. A system where there's you, the healthcare provider, and two dumbass middlemen who get to do way more than they should in your life. First, the insurance company, whose job should be to lower your healthcare costs, but they end up being an uninvited third party. Let's talk about that. So let's talk about that insurance company. Consider your average cost of a medical procedure. Now add the cost of the doctor and each person who you had to speak to in sequence at the hospital. As there were 8 to 9 people you had to talk to that all decided that they actually knew more about the pain you were feeling in your body than you did. Their salaries all need to be paid. And one of the people in this area is the healthcare worker whose only job is to figure out how you're going to pay your bill and run your insurance. And then there's the insurance company itself, which has a CEO who needs to be paid and shot, and several thousand workers who need to be paid as well. The health insurance company needs to make enough money to be profitable, after all, while employing thousands of workers. Did you know that Blue Cross Blue Shield alone employs over 150,000 people? When you seek medical care, your money needs to be able to support all of these people who, in a functioning medical system where our needs were just met, would have different, less parasitic employment. Now, this is not to disparage anybody working in those industries. After all, there are people in my family who work in them. But you do need to know you're participating in a system that is really fucking predatory, and if it disappeared tomorrow, you would be out of a job, and I hate to tell you that. But this leads us to the second middleman involved in your healthcare. That second middleman, well, this person should be involved, but not in the perverse, twisted way that they are now. This person is the politician. Now, the job of a politician, in theory, is that of a public servant. Their job is to hear which needs their constituents have and address them. Aging population? Route funding into the retirement centers. Lots of trans people in your population? Seek more specialists on gender care. After the 40s, though, what does the United States politician actually do? Well, they take money from a pharmaceutical lobby as well as the insurance lobby in order to keep a broken system propped up and siphon money from you. In 2023, the medical insurance lobby spent over $150 million trying to get politicians to twist our medical system into something more profitable for them. And you can see the data from Open Secrets that showcases exactly how this has been a constant and even upwards trending habit of spending by the medical insurance industry every year since the 80s. How do you fund a system like that? A system that needs millions of dollars every year to convince politicians how much you need them. And let's not even talk about the $500 million spent last year on advertising to you specifically to convince you that these medical insurance agents are actually necessary. A system that should have you, who needs care, your healthcare provider, who provides care, and your political representative, who makes sure you get access to that care, now has you, who needs care, the insurance who sells the care, the insurance industry who sells the money to buy the care, the politician who protects not you, but the insurance industry itself for profit. By the 90s, around half of Americans were actually uninsured, and that number didn't see a significant drop until the Affordable Care Act was introduced. But as we catch up to the modern day, we got to ask ourselves if a multi-million, nay, billion-dollar industry has to spend so much money just to convince politicians and you that it's an important part of your healthcare experience, what effect do you think that has on the cost of your own medical care? Let's talk about that. What if I told you that there was a system that asked you to pay some money into it in order to be covered medically in case something bad happened to you? If you happen to fall ill, you could call upon this system to take care of medical expenses, or at the very least help out with them. A system that only asked your participation as a greater part of a whole in order to keep large swaths of everybody else medically secure. Now, at first, you may be thinking that I'm talking about a single-payer healthcare system like some kind of filthy socialist, which I am, but that's not the point right now. I'm actually describing health insurance in concept more than anything else. You see, the point of health insurance, or at least what we're told, is that each of us pays a little bit into a system that creates a giant safety net for everybody else, just in case things go south. You might get a perforated lung, or a hemorrhaged butt cheek, or some other wayward illness. Who knows what could happen? And what about your kids? Surely you want them covered just in case anything untoward were to happen to them. Who knows what all kinds of terrible illnesses could befall them on the playground? You should have them taken care of just in case. Here's the issue, though. Health insurance, like I said in the last chapter, is an unnecessary middleman. An unnecessary middleman that actively makes the other middleman, the government, actively engage in worse advocacy for you. We'll talk about the politician's role more in detail later, I'm sure, but for now, let's focus on just how many dollars the medical industry for insurance is wasting. We already spent over millions of dollars in the last section. We went over how millions of dollars is spent on advertising, lobbying, and other, let's face it, useless fucking endeavors that only serve to convince you about how necessary these parasites actually are. So much so that so many of us were just so happy when Luigi Mangione allegedly did not shoot that one guy from United Healthcare. It's funny that we remember one person's name in that scenario, and we remember it fondly. Let's talk about healthcare costs, though. For an insurance company to make a lot of money from you, they need to make you feel like you need to buy in. Obviously, this is done with advertising first and foremost. $50 million a year don't get spent for no reason, but they do get spent convincing you to buy into healthcare packages. $50 million down the drain just to convince you that you should be paying into a particular system. After all, you don't want to be dealing with exorbitant healthcare premiums that will bury you financially, so just pay it. It'll be fine. But the reality we live in is that, man, wouldn't it benefit the insurance company for you to have fear and anxiety 24/7? How best could an insurance company instill this fear of missing out on their wonderful packages to you? Well, simply put, it's by negotiating prices with pharmaceutical companies and hospitals to create the illusion of necessity. Here, let me give you an example. If you go to the hospital and you get ibuprofen for pain, there is a pill that will cost you $10 if you buy a pack of 200 at the grocery store. But magically, if you get it at the hospital, it costs you hundreds of dollars for the privilege of a nurse handing it to you. Now, I know that could be somebody's fetish, but this isolated scenario is unfortunately the end result of hundreds of negotiations between insurers and hospitals. Costs of goods and services in the medical industry are artificially increased, sometimes 1,000-fold, in order to threaten to bankrupt sick people who just need medical help. But artificially high costs for individuals really aren't all that's going on. And on that fact, well, insurance companies don't pay out based on the quality of the care you receive, but instead based on how many individual things the hospital can charge you on. It benefits the hospital more if they can charge for 10 different tests, multiple painkillers, and other superfluous services in order to rack up a ton of money from you, and when they do so, two scenarios present themselves. In scenario A, you're insured, and you're so thankful that the health insurer could step in on your behalf to pay these exorbitant costs. Or scenario B, you're terrified and wish you had health insurance, and either way, the insurance company still fucking wins. The question is, why is it that way? Why is our medical industry so dependent on a middleman that seemingly brings no value to its customers or the hospitals that it patronizes? The answer simply could just be marketing. And we could dig into that for a bit, but there is more to it than that. For instance, there are numerous news outlets, pundits, and others that will argue the U.S. has the best healthcare in the world. After all, the Fair Observer says just as much there. Independence, diversity, debate, healthcare in America is the best in the world. It's often used as a whipping boy for its high admin cost and burden and cost of care, but the United States is the best in class for pay, research, and innovation in certain high-profile clinical outcomes. Certain high-profile clinical outcomes is carrying a lot of weight in that fucking title, don't you think? Now, these people will cite that you get what you pay for, or that our wait times are so low, or any other number of arguments to help prop up the insurance industry status quo. But when you step out of the isolation chamber of the US and advertising and its propaganda, well, you hear things a little bit differently. In America, you may hear that government regulations are the reason for high healthcare costs.
Market, because they feed each other. When you have the free market, and this is something insurance companies don't want, they want the big handout from the government. They want the crony capitalism. They want the government subsidies, because that means guaranteed profits for them. So, they don't want competition, because that means they have to lower prices in order to lure customers in.
Now, it's really funny watching Fox News go just on about how government subsidies are actually the thing that insurance companies hate. But, you know, I don't really give a shit about that at all. I don't have a reason to give a shit about that at all, because the healthcare subsidies are a side effect of not having a single-payer healthcare system at all. These people will argue that these government regulations are the reason for high healthcare costs, actually. The healthcare costs would be better if we just let the free market do its thing. But you'll find that in reality, the US constantly ranks lower than every other developed country, oftentimes the lowest in healthcare costs, healthy outcomes, customer satisfaction with care, life expectancy at birth, and Americans end up seeing physicians less often, not because we're any healthier than others. No, we're fucking obese as fuck. In fact, we see some of the most chronic conditions and untreated conditions of any country. No, we don't see physicians because we can't afford to. That's the problem. And things are only getting worse. Now, granted, the article that I was looking at for this essay was from 2022, but I don't think things have gotten any better in the current political climate. I don't think things have gotten any better under Trump. I already spoke about some services or medicines that you've probably been overcharged for, painkillers that cost pennies outside of the hospital room but cost hundreds inside the magic walls of the hospital. Yay. These are the bottom of the barrel, though. But most of these inflated prices can actually be found on a hospital's charge master. Now, if you don't know what a charge master is, well, a charge master is a comprehensive list of a hospital's products, procedures, and services. Everything from prescription drugs to supplies to diagnostic tests and unique prices listing anything. It's all in the charge master, making it a go-to document for hospital administrators. Instead of using the market price for goods and services, you know, that thing that Fox News is just so confident will fix everything, hospital admins know that you can't get medical care anywhere besides their clinic. Oh, sure, you could go to a different clinic, but it'll also have a charge master ready and waiting to slap a giant price tag on your next treatment. But how did this actually happen? Well, insurance companies, acting like middlemen for your healthcare, negotiate with hospitals for incredibly large discounts on care. But there's only one problem. If an ibuprofen costs a couple cents on the market, then what kind of a fucking discount can an insurance company hope for that's going to matter to anybody at all? Well, the way they do this is they negotiate an exorbitantly high price so that they can tell you that they were necessary in lowering that exorbitantly high price. Hospital admins and insurance companies together worked out a solution to make this happen. Huge fake prices that nobody in their right mind could ever fucking afford, so that insurance companies could get a massive discount on any item they wanted. And in fact, as the cost of healthcare goes up, the cost of health insurance premiums is allowed to rise at a similar rate. So it benefits hospitals and insurance companies to keep tacking on more zeros to that price tag on your care. As an example, if I want to sell you Adderall that you may need, and I may need, for your ADHD that I totally don't have, this will cost me about $10 maximum to manufacture about 25 milligrams of the stuff. Maybe even less in a factory setting. But for you, oh, you, without insurance, a hospital's going to charge you $300 for that shit. No wonder people started buying Adderall illegally in order to just get the medication that they need. So if you're insured, you see this $300 price tag and think, oh, well, I'm paying a few hundred a month for insurance after that lower cost of this thing. Wow, what a deal. But you're not actually thinking this thing costs 10,000% less for a manufacturer to make and ship. Damn, I'm being ripped off. And, you know, what can you do about that? You can't control the charge master or the negotiator from the insurance agency, and nobody in the hospital has any influence over any of these things, at least nobody you'll ever speak to. I mean, hell, you might be able to kill a CEO about it, but that's only going to do things temporarily. Why is the system like this? Well, let's see. Let's see how much money that the medical insurance is actually making right now. How much money is the medical insurance companies at large making? Oh no, I pulled up the National Association of Insurance Commissioners to show that just a few years ago, they made $18 billion. Billion. Profit. Net. Billion. And they made $16 billion the year before that. These numbers are only going up. I want you to fathom for a moment, just a moment. I know it seems like such a tiny amount. In the fact that, you know, there's multi-billionaires or maybe even trillionaires soon like Elon Musk. But just for a moment, consider that you're working your dream job and you're making $50 an hour. Most of you watching this video are scraping by on a tenth of that, if not less. But $50 an hour, that's $104,000 a year, give or take. Most of you will work every waking day of your life till the day you actually die with little chance of an actual retirement. But let's pretend for a moment that you managed to be happy and healthy and you were working all the way to age 100. You were just, God, look at you, slugger. All from the age of 18, 82 years of solid work. Nobody fucking does that, but let's say you did. Well, you actually have to show for that. $8.5 million on the day you're on your deathbed. And that's not counting the overhead you had to pay for, you know, living, paying for school, food, bills, kids, and yes, even fucking healthcare. $8.5 million. Best case scenario for most of us ever. A pipe dream for anyone with half an ounce of sense. So how many lifetimes would you need to work in order to make as much money as the medical industry made in just profit, not how much it made gross, just profit? You would need to work 2,117 lifetimes to make as much money as the medical industry made in 1 year. Well, perhaps you're thinking, that's not fair. You're comparing an entire industry to one person. And to that, I'd say, well, then let's just take Blue Cross Blue Shield, the one I mentioned earlier in the video that had a net loss of $12 million in 2023 on a total profits reporting of $2.4 billion, which would mean you would need to work 235 lifetimes. That's insane, though.
No, that's wrong. Try it again.
Actually, turns out I misread this shit. I misread this shit completely. Sorry, that wasn't 2.4 billion. That was 9.3 billion. I misread that. It turns out that I was reading the quarterly amount, not the actual full amount they made that year. And it's right here from 2023. Yay. God, I love our system. Our system is great. There's nothing corrupt about it at all. Everybody makes money and everybody is happy. It's not exactly like health insurance guarantees you care in the first place, though, right? Did you know that there are jobs where the sole purpose is to find a way to deny you healthcare coverage? That's right. Healthcare insurance companies pay people to find loopholes that will allow them to deny claims. And it makes sense, right? If they have to pay out $5,000 for a wheelchair or $10,000 for a surgery every few weeks or pay one guy about $60,000 a year to deny a bunch of those claims, well, the numbers kind of speak for themselves. If you've got thousands of people insured and you have hundreds of claims a day, well, having one guy that's able to just deny a bunch of those, it's just a cost-saving mechanism at that point, right? People get boiled down to numbers. Here's an experience that one viewer submitted to me, working in our nightmare healthcare insurance scenario. While I was working at Hinsdale Hospital, one of the nurses there had a son who suffered a major skiing injury. He had that ball joint in one of his shoulders completely crushed and had to have it fully replaced. The hospital employee insurance was through Humana, and she and the doctor had gone through all the necessary steps to approve the surgery and make sure that they were in network. However, the night before the surgery, Humana removed the doctor from the network so that the surgery would not be covered. The doctor was not informed of this prior to the surgery. None of the medical expense was covered at all. The family just had to eat it. What? How does that make any fucking sense? Nobody on the ground was at fault for any of that shit, and yet that still fucking happened. But that's not the only story that I got submitted to me for this. During a major ice storm, I fell and broke my arm in January of 2024. I had to be transported to the hospital by ambulance, and the hospital took good care of me until I had surgery. Unfortunately for me, I reacted badly to the surgery and had some sort of reaction to the metal that was used in it. We didn't know this at the time, but I woke up after the surgery in extreme agony to the point where I had trouble walking or thinking. I had to take an ambulance again. The hospital accused me of drug-seeking behavior and sent me home. Although they did say, well, that was a big surgery, maybe he's not lying, I had to have another surgery to remove the metal. Anyway, this isn't the horror story. The horror story is the $4,000 ambulance company has been harassing my friends and family for. They called me and asked me to pay it. Apparently, my insurance only covered $38 for each ambulance trip as if it were a taxi. But here's the shitty thing. The ambulance company, Arrow, owned by Carl, refused my money. They demanded I call my insurance and order them to pay Arrow more money. And if I didn't, they said that it would go to collections. I said, fine, fuck you, send it to collections. However, they were lying. They never actually did that. After I left my job and lost that insurance company, Arrow Ambulance started calling anyone that they thought might know me in an effort to get my friends to pay them. I think they're calling me too, but I don't answer 312 area code phone calls anymore, and they don't leave messages. That's fucking terrifying. Not only being mistreated by the hospital as if you were a drug addict undeserving of care, but then being financially hounded afterwards despite literally having done everything exactly as the system intended. Or I've got another experience that a United customer had. This one is from Heather, and they said that United Healthcare refuses to pay for a COVID test at the beginning of the pandemic because it wasn't medically necessary, even though I wasn't allowed to return to work without it. This was before the government forced them to cover pandemic-related things. Yeah, I wonder if anybody did anything about greedy United Healthcare officials. I wonder. Or this story from Turning Tide Studios, one of the original artists for the channel. Because of the paralyzing fear of being punished by the medical industry, had this story to tell. Fear of medical debt and being sued by the hospital again is what kept me from seeking medical treatment when I had the first signs of a brain bleed. 2 days later, I had a stroke that forced me to go instead. If I had only listened to my gut and went when I wanted, I could have gotten the bleed under control and avoided the stroke. Subsequently, I would have never had developed epilepsy, and I wouldn't be dependent on others. Because of my fear of more medical debt, I almost died, and I suffer with seizures caused by my stroke. Or another instance of being unable to get medical help despite knowing you need it, all the while paying into the fucking industry. This one is from Novalex Rin. I said, oh boy, do I. I will try to keep this short. It took 5 years, 5 different doctors, all trying to medically gaslight me until I moved halfway across the country, got scolded by a surgeon because I didn't get the knee surgery 5 years prior, but after he did the surgery, it took 5 months, several tests, and a new primary doctor to be believed and get diagnosed with POTS, despite test results saying that I had it. I'm still mad at my previous primary doctor over that and the other stuff she refused to help with. I was ignored and gaslighted about all my mental health issues until I had a complete breakdown and almost self-unalived. It took over 1.5 years to get a stomach problem solved, which was from a medication. It took several months to get gallbladder surgery. I wasn't told that I had endometriosis until I was an early adult, so I just had to suffer with it until I got a hysterectomy in 2021. I didn't get a growth on my thyroid removed until it got so large that it caused me to choke, and they had to remove my entire thyroid. Or this story from Tristan Cox of the long-term ripple effects because insurance randomly decided that they don't need to help any longer. Not sure if this would count, but as a teenager, I was actually taken to get inpatient psychiatric care at a hospital. It was good for me, got me out of an abusive household for a bit. Then, one day, as I was making progress, insurance stopped covering it. I had to leave. And honestly, that single decision has had some really bad downstream ripple effects because Humana decided, this kid doesn't need help anymore. I decided, I sometimes wonder how much better off I would be had I been able to stay longer and get more help. Not sure if this is bad enough to count, but for me, it was a small incident with a huge ripple. Or what about this situation where putting weird restrictions on people who are suffering from addiction forces them to go to a religious multi-step program before saving their fucking lives? This is from a J. Macbeth, said the fact that you have to attend Alcoholics Anonymous in order to get on the donor registry in Florida caused my mother to die because she couldn't get on the list. Apparently, it's how they keep alcoholics from getting a new liver when they need it, knowing that they won't admit they have a problem. My mom refused to tell us what was actually going on other than that she needed a new liver. They wouldn't even let my bro donate part of his when he was a match. My mom could have lived. She even quit drinking several months before she passed on her own. The system failed her and caused her death. My favorite part of all this was when we sent her to different hospitals to get a second opinion, not knowing that she was hiding things so she could get a second opinion. They would keep getting the same doctor even though she would ask for a different one. And if your insurance gets really specific about what they want to cover, well, I have another story for you from the same traveling MRI tech from earlier. They said, anyways, one story I have of insurance screwing someone over is when I was working in the OR as an X-ray tech, a step below being an MRI tech in some states. Because you usually have to be billed up to becoming an MRI tech. Was when an orthopedic surgeon I was working with was informed literally in the middle of his surgery that health insurance isn't covering part of a patient's condition, which in this case was a uniquely bad torn PSOAS muscle. The surgeon saw that during the surgery, surgeon saw that during the surgery and noticed it on the patient's MRI and figured he'd do a little bit of suturing to put it back. However, the insurance said that the primary concern was the broken back and not the torn psoas muscle. So they only paid for the specific parts of the bone surgery and not the ortho surgeon that was trying to be proactive and help get the patient better. But afterwards, the insurance got back very quickly to them and said they would not be covering the parts used to fix the psoas muscle and requested documentation immediately of the change in the surgery. So a doctor trying to do their job gets to be the bad guy for a patient's wallet because the insurance companies, well, their bean counters decided that keeping the patient healthy wasn't actually their fucking priority. So they started tackling issues, well, one at a time in the least efficient way possible. That's what they wanted you to do instead. Now, this is all in the hypothetical world that your doctor and the hospital are actually in network, because that's something that shouldn't fucking make sense. But, you know, the 3 Ds in insurance companies are delay, deny, and defend, after all. Delay your healthcare coverage as long as possible, deny your claim as soon as possible, and make you defend your claim in court as often as possible, since you can't afford the same lawyers they can. They can bankrupt you. But we'll talk a little bit more about insurance poverty in the next section. It's 2024, and you've just come home from a long day of work, so you ordered some food to kick back and relax with. You open Uber Eats. Since you pay $10 a month for it, you might as well. You select your options. You know, they're a little overpriced, but it's whatever. Then you open Netflix to put on a show you've been meaning to binge, but is it actually on Hulu? Disney Plus? Paramount? Whatever the hell Peacock is? Maybe it's on Amazon Prime. You forgot which ones you actually are subscribed to. You've forgotten which ones are even worth being subscribed to. And you get frustrated, so you open up your phone and you decide to play a mobile game. Let's say Pokemon TCG Pocket. Why not? And then that game asks you for a monthly subscription to whatever the fuck it's got going on. Maybe it's a battle pass. Who knows? You say, fuck it. I'm going to go to my computer. I'm just going to go play something else. So you sit down and you boot up another free game, and it's also asking you to buy a battle pass, and it's throwing banner ads at you and everything else. It's every possible way that it can micro slurp money away from you. And, you know, you had the audacity of wanting to play your game. That's what happened here. Your internet, which is a necessity in this day and age, is actually also a subscription service. Your phone, which is also a necessity in this day and age, is also a subscription service. Your entertainment begs you to funnel more money into shit you've already bought. And you decide you've had enough. You decide to work off all this frustration at the gym. By the way, you have a subscription to that too. You forgot to go there, by the way. You should probably actually use that subscription for something. I'm begging you. Obesity is an epidemic in the United States, and just in general, it's better to be healthy. Anyway, you get back in your car, and your car just asked you for a subscription to heated fucking seats. And in your rush to escape yet another subscription service, you crash your car. You were still making payments on it, by the way. Luckily, you pay monthly for car insurance. Maybe it can replace your car. The ambulance takes you to the hospital. And you get a painkiller. You get some care. But, you know, the first thing you hear from them is not, what do you need? No, it's, hey, can I get your insurance information? How do you plan on paying for this? Now, the solution to the problem that you've got yourself right into right now is yet another subscription service to your health. You ask your doctor meekly if their pills come in 9mm form. Games as a service, food delivery service, television service, peace of mind as a service, it's all the same thing. You get to own nothing, but you get to pay for it monthly, and you get to be happy about it. Man, just recently, Pokemon released Fire Red and Leaf Green, and people got pissed that Nintendo had the audacity to sell them instead of putting them on the paid subscription service for Nintendo Online. My guys, I am happy to be able to buy something and kind of have the idea of owning it instead of having it locked behind yet another fucking subscription service. And any attempt you take some highlight of your life, or even a necessity, you try to divide its cost up enough that you won't notice the impact in your monthly expenses. And yeah, that's just the Amazon Pay in 4 service. That's just every service that wants to have you pay 12 or 18 payments of some shit. The problem is that you do eventually feel these things once you go to the grocery store and realize you can no longer afford your usual staples because you're buried in fucking subscription services. Not because of the inflated cost of goods at the store, though they certainly are inflated even more now than when I originally wrote this essay, but also because you simply have less money in your account. Oh, and each of these subscription services, they've got a sweet deal going with your local bank, if you weren't aware. You know that overdraft fee you get from the bank every so often when you don't have enough money to cover your expenses that day? It's usually like $30 or so, and then they have this interesting rule I encountered whenever I tried to get them to turn off this awful system. They said, oh, we can't deny any transaction that looks like a monthly bill. Our only option as the poor bank is to make you pay an extra $30. Now, it's really fucking stupid because the bank is perfectly willing to deny me my ability to buy groceries if I have no money in my account. But if Netflix wants money, if the gym wants money, they are 100% okay with charging me an extra $30 so they can get their money. We all became really adjusted to this system over time. But, you know, here's the scenario. You build up this veritable treasure trove of monthly subscription services, and then they automatically charge your bank account, and you forget for even a moment that there's an added charge for each of those subscriptions for taking you further into your financial negative. Netflix can pull its $30 for an overdraft protection, and then Adobe can pull its $30, and then you have the audacity to try to be an artist who works in film, so, you know, fuck you for trying to have that subscription service. Man, it's almost like the buy once, cry once model has kind of disappeared for a lot of things. Now you are buried in subscription poverty. Now, it's weird because when I originally wrote this, I wanted to talk about insurance poverty specifically because that is a topic as well where people have car insurance, house insurance, health insurance. They have so many things insured that they can't actually afford things, but those concepts were actually brought up as economic problems well before everything became a fucking subscription model. So now I'm just going to go ahead and call it subscription poverty, and that includes your health insurance because that is also a fucking subscription model. Now, you were fed a bunch of sneaky subscriptions, usually with them going like, hey, pay $1 for your first month, and then maybe you'll just forget about them in the future. And so you don't realize that they've piled up so goddamn high, and now you're unable to afford basic necessities, and guess what? Like I said, health insurance is no different. There did used to be a term called insurance poor, where you spent so much on health insurance, car insurance, house insurance, life insurance, that you didn't have any money for yourself. You were spending so much money, legally forced to in some situations, thanks cars, on every little paranoia about what possibly could happen to you, your health, your wellness, your kids, everything else. And now you no longer could afford healthy foods or healthy coping mechanisms, causing your health to spiral anyways. And then suddenly you become increasingly reliant on that health insurance to keep you up and stable. Now, it just so turns out that the US government was, under Biden, trying to rein in these subscription services and their more predatory practices. But, it's 2026 and things have changed a little bit there. Originally, I wanted to make this section about not being able to afford basic necessities because of how costly just health insurance was. But before you go to the comments typing, but the Affordable Care Act, please understand what a bandage on a problem looks like instead of a cure. The Affordable Care Act did, in fact, help people. It did, in fact, make sure more people were insured to take care of all of their needs. I get that. I agree with you. I'm on it myself. But let's go over some problems, shall we? The first and most glaring one, it doesn't actually help people who are sufficiently buried in poverty. Let me paint you a scenario. If you can't work because you're chronically ill, but chronologically, I guess you'd be ill too, there is treatment available for your chronic illness, but you can't afford it. Now, under treatment, you might be able to go to work that has health insurance bundled in, and that's super sweet. Weird, but sweet. But it's a bit like putting the cart before the horse in your scenario, right? You're so chronically ill, you can't really work well enough to get to the 6-month status that will allow you to get that health insurance in the first place, or the year status, or the wait until you're full time so you'll never actually get it status. So what other options do you actually have? Well, there's illicit drugs to keep you from dealing with your chronic pain, but those have issues of possible overdosing, and they don't really treat the problem. And if you go and get a job that requires drug testing, then you might find out that you have been taking some illicit shit that's going to prevent you from getting that job in the first place. So that's not going to work. You need something different. You need governmental assistance. So what about the Affordable Care Act? Well, it could help. It really could. But did you know that to apply for anything on the marketplace, you must be within 400% of the poverty line? Now, that may seem like a good thing. Like, that's a really, really high amount of leverage that you have, but you make well under the poverty line because you don't have a job. And since that line goes both ways, you are in fact too poor to get financial assistance with the Affordable Care Plan. That's nightmarishly stupid, isn't it? That a system that is designed to help people who can't afford medical help can let you fall through the cracks because you're too poor to afford the medical help. But now we're back at stage one. You need medical plans to get a diagnosis. You could get governmental financial assistance, and then you can afford an ACA plan. Problem is that you need a work history to show you failed to work to get a diagnosis, so you need a diagnosis. But you need a doctor for a diagnosis. Problem is you need a medical plan to get a primary care physician in order to get a diagnosis. So you're back to stage one again. Your chronic illness is preventing you from being able to get to work, which prevents you from seeking care, which prevents you from living your life. You ask a hypothetical doctor once more for a hypothetical pill in 9mm form. And remember, this is all happening in an environment where no well-meaning friend or family can just buy you out of this, because the majority of anything that you may need is also a subscription service. So get fucked, I guess? That's also assuming you've got the friends and family willing to help in the first place. And by the way, so many of these subscription services have not been deemed actual necessities, despite the fact that you and I both need power. And, if you live sufficiently south, air conditioning, sufficiently north, heat. You need internet to do damn near anything these days. You need a phone to be contacted by a job. These are all necessities. Oh, also, water, a basic necessity to survive, isn't actually considered your right by many companies.
Die eine Anschauung, extrem würde ich sagen, wird von einigen von den NGOs vertreten, die darauf pochen, dass Wasser zu einem öffentlichen Recht erklärt wird.
The ACA is a wonderful system, but make no mistake, it is a band-aid on an actual problem. Its entire purpose is to prop up a broken system of American health, and instead of addressing our system's failings, we've introduced yet another system on top of it, with the sole purpose of helping people buy in to feel secure until they make too much or too little money, or most likely some other well-meaning politician does away with the ACA and leaves the majority of America careless again.
Mr. President, yes. A health-related question on your health care plan. You've said you want to make direct payments to Americans, but these Obamacare subsidies are expiring now in a matter of just a few days. More than 20 million Americans are now bracing for their premiums to skyrocket. Are you going to let this happen, or will you intervene?
Yeah, they will skyrocket because it was never any good. I'd like to see the money that is going to the insurance companies by the hundreds of billions of dollars. You know, their stocks are up 1,400%, 1,800%, and 1,624%. Their stocks are up through the roof over a fairly short period of time because they're getting vast amounts of money. I want that money to go to the people directly and let the people buy their own health care. And they'll get much better health care than they get with the Unaffordable Care Act, as it's known by a lot of people. It is virtually unaffordable for people. It's a bad thing. We can have a great thing. Let the money go directly to the people and let them buy their own health care.
Even with the ACA, though, we still get to select through a bunch of artificial choices for hospital networks for insurance, right? Oh, did I forget to mention, in the United States, being insured doesn't actually mean shit. You have to be able to go to one of the few specific selected medical establishments that your insurance allowed you to go through. For instance, my insurance at the time only allowed me to go to Wellstar Hospital. So if I'm traveling and a Wellstar Hospital is near when I get injured, great. But if I have to go to, say, Kaiser Permanente, well, they will not do anything. That will not be covered. That if I'm on an ambulance going that way, I guess I'm just fucked. And why? Well, money. It's just money. It's always money. Every time it's money. Some bean counter sometime learned a long time ago that pretending competition exists within an industry drives prices because customers feel like they can compare prices. They somehow have control over them by being able to compare them. But this is an illusion of choice in a lot of cases. As an example, if I have one health insurance plan that costs $300, well, that's it. I may feel like I'm getting ripped off. But if there are 3 insurance plans and one is $500, one is $450, and then there's the $300 one, well, now that $300 one looks like a fucking steal, doesn't it? And this is all to make it feel like you bought into something that you want rather than the truth of which is that you were given an artificial choice between types of coverage that may or may not actually help you. It all depends on how much some underpaid number cruncher managed to figure out, because costing you more for less, well, that means health insurance companies can get more profit if they can make you pay more money and give you less coverage. Again, they do spend a lot of time trying to deny claims. After all, I wonder if anything happened to anybody who was known for denying a lot of claims within one of these companies. More on that later. Or before? Who knows? Do you like Mario games? Now, maybe you could spend some time just enjoying some reruns of your favorite show on Netflix. But again, we go back to the beginning of this, where that show might be on a different subscription service. Have fun paying for another one, I guess. If you've spent any amount of time discussing the ins and outs of the failures of the U.S. healthcare system, you're sure to have brushed up against a major point of contention against the idea that our system needs to be overhauled. You'll be on a wait list, and they'll usually cite Canada or somewhere else as an example, some kind of medical system where people go on wait lists and then die or something to that effect. If you've ever actually been to the emergency room in the United States, you know that you have to be on a kind of wait list for that triage as well. And if you've ever tried to get your primary care physician to schedule a test or a scan or any kind of surgery, well, you know you've had to wait for that as well. So you may be asking yourself, if everyone has health care, Won't that increase my wait times? Won't that make it take longer for me to get healthcare? To which I'd say yes, technically, but there's a lot of caveats there. Firstly, we don't seem to be talking about the artificial wait list that occurs when you are an American with a chronic condition who cannot afford a diagnosis. Surely, a financial windfall might happen, like what has happened with me. A wonderful patron has come in multiple times and gotten me out of a jam, but that is something that not everybody has access to. Sure, with a financial windfall, you may be able to begin the process of getting your tests, scans, and get that all taken care of in swift order, but how many people have cataloged the exact time they've been waiting for care from the moment they needed it, as opposed to from the moment they started moving through the stupid-ass bureaucracy of the United States medical system? I'd argue that, well, due to lack of care, lack of checkups, which leads to a lack of knowledge about when a problem even began occurring in the first place, that the United States, well, it has a lot of artificially inflated wait times anyway. They're just kind of invisible to us. But let's say we do implement something along the lines of single-payer care, and wait times do increase for several aspects of medical care. On the one hand, that's inconvenient for those with the money to buy in, but it's kind of a net better for society because those who didn't have the money to buy in can now afford to live. And any argument that them not receiving care is a standard that we should be pressing for may not be familiar with just how many Americans feel financially stable but are actually one paycheck away from being homeless. Like, so many of us just kind of feel like everything's going hunky-dory in our lives, and then the minute it gets kind of ripped out from under us, we're just kind of fucked. But by the way, statistically, you're likely to be one of those Americans. You might just be a little deluded into believing otherwise. Anyways, in the event that we do have those increased wait times, and we've accepted that this is a better world than the one where people just simply can't get healthcare at all, how do we fix the wait time issue? Well, that answer is really simple. We employ more doctors. We employ more nurses. We make more medical professionals exist. We build more medical infrastructure, hospitals, clinics, pharmacies, stuff to handle the extra load. But we have a problem in the United States, and that's that hospitals are severely short-staffed right now. This is not the only industry where we have short staffing. We are running out of fucking pilots as well for similar reasons. People can't afford the schools to actually become that profession. So we just run out of people in that profession. You might be wondering, why do we have less people than needed to staff hospitals? And well, this comes down to a few things. But after COVID, we have a couple of issues. Remember the people that said it's my right not to wear a mask and ivermectin will fix everything? Well, eventually, those people found their ways into hospitals during the pandemic, and usually they were about to win their Herman Cain Award, or they were there for a family member who they were basically killing by telling them that the doctors and nurses were liars. A bunch of medical staff got abused. Massively. So, with these entitled Karens being told by conservative media and Facebook feeds that they have a right to do whatever the fuck they wanted and fuck the rest of us, they insisted that they were completely allowed to ignore all rules or requests because of pure childhood obstinance. Now, if a nurse asks you to please wear a mask and not cough on other patients, and you yell, "No, it's my right and you're violating my HIPAA," or some shit, then yeah, that's kind of fucking stupid. These people would rant at nurses and doctors for prioritizing science over the snake oil theories that they were being peddled by the conservative entertainment channels and the fucking White House at the time. It makes sense why so many medical workers started leaving the industry. If they're being treated like somebody who's working in retail or food services by angry fucking Karens anyway, then what's the point of taking the harder job? The other problem with healthcare workers in the US is that rural communities have less of them. Hospitals in rural areas pay less, and people who are getting medical degrees are smart enough to see that they could do better, and, well, they can do better financially in larger areas, so this leads to something called brain drain. In rural areas, you have people just leaving. This leads to understaffing in those more well-populated areas, too, as people move into cities and places that are more population dense that have more pay. That's a story for a different video, though, one that I might not actually be able to write, considering that I wrote that line around the time that I thought I was going to be doing video essays for the rest of my life instead of still streaming. Anyway, What's the reason for the short staffing then? It's money. Again, it's money. Plain and simple. Even if the ideal scenario where people are educated and trained and prepared to do work, hospitals make more money when fewer people are working in them. This comes down to the simple fact that hospitals in the modern day should be there to treat patients, but the actual goal is to make money. And hospitals, like every industry ever, makes more money when it is understaffed. This means that instead of asking, how are we going to treat these patients who need help, most Americans immediately jump to the age-old question of, well, who's going to pay for it when somebody talks about single-payer healthcare? So, let's get a couple things out of the way. Firstly, a for-profit hospital does not increase your likelihood of survival. Actually, the profit incentive for hospitals increase the likelihood that you will not receive care. And medical insurance agencies even have a wonderful stat for how much care they are able to deny you, because denial of health care is big business for insurance agencies. After all, the 3 Ds of insurance agencies are delay, deny, defend. Delay the insurance claim as long as possible, deny the insurance claim immediately upon having the chance to, and defend the denial in court, which can financially drain any insurance claimant, but don't worry, the insurance company is going to be A-okay. They got plenty of money. This is abuse. If we are forced to endure a broken system in order to participate in healthcare that we fucking paid for, then we deserve that healthcare, not a draining exercise every time we need to be taken care of. Some citizens have even taken this into their own hands. I told you we'd talk about Luigi again, like killing an executive of United Healthcare, an insurance firm famous for denying a third of their claims. Now, I can't endorse violence on this channel, but I can understand the perspective. How many bodies did the United Healthcare CEO have? How many was he directly responsible for based entirely on insurance claims that were denied, or the people they've dragged through the legal system to justify their abuse of their clients? And yes, it is abuse. If I pay for a thing and I need that thing to save my life and you dangle it above my head and then deny the fucking claim afterwards, that's just abuse. End of story. Moving on to the hospitals themselves, before I say something that's going to get me banned on YouTube, if you've worked at any business before, you know about the performance reports your bosses have used to determine if you are working hard enough. Well, it turns out we use those same performance reports in hospitals as well, and they actually make care worse. Picture this. A surgeon finds out that their yearly performance review is based, in part, on the success rate of the surgeries they perform. Now, they've got a couple of options here. They can engage in life-changing, life-saving, risky surgeries that can save patients' lives, or deny as many of those surgeries that they are qualified for as possible to stick to safer surgeries like appendectomies. In the former scenario, their job may be at risk because of medical malpractice or any number of things that people can aim at them. Doctors have to pay a lot in insurance, by the way. But in the latter, their performance gets glowing reviews by their higher-ups because they've taken a series of easy surgeries and got amazing, outstanding performance reviews. Artificially increasing your rates of performing successful surgeries does nothing to make medical care better for any of us. They just make people feel safer and more accomplished and only serve to make some random fucking executive happy. But before someone can even become a doctor in the first place to gamble with their medical license every time they try to take a risky procedure, they have to accept borderline crippling debt in order to engage in becoming a doctor or nurse. 4 years of college for a medical degree will run you about $270,000. That's just for a bachelor's. Many hospitals want to deny people even with this degree and make you pursue a master's or a doctorate degree. This means that doctors need to recoup this education cost somehow, and forcing them to take higher-paying jobs outside of rural areas that desperately need those doctors perpetuates the issue of lack of medical personnel, and now we're back to brain drain again. It also serves to gate people from engaging in these fields in the first place. If people want to be part of the medical industry, and they can't due to being unable to afford the degree, then that is a natural barrier that keeps more and more people out of hospital work, which will naturally drain hospitals of their workers as the current ones that are in the system age out or retire. We can even talk about how hospitals have to cut corners with their facilities to save dollars every day. And yeah, you heard me right. Those giant, well-kept buildings where cutting-edge medical stuff happens every day, they're finding shortcuts like your McDonald's worker on their 13th hour, and it is scary as shit. Here's one story that was submitted to me. This one said, so I'm a traveling MRI technologist, and I saw many areas where hospitals would cut corners. In some cases, they do things like run their own RIS systems, basically a software that organizes all of your tasks for the day, and they'll be incredibly clunky and be ran off of Internet Explorer. Not Microsoft Edge, Internet Explorer. They would also cut costs on buying necessary medical equipment, like Coban, Band-Aids, mattresses, and lots of other very simple things that they'll just cut off because they don't have the budget. Now, a traveler, in case you didn't know, a traveler is somebody who does independent contracts with hospitals to fill in the shifts that the managers are unable to fill. Where basically the manager's punishment is they have to pay large amounts of money to have us work there every day, yet they're unable to pay their current hospital workers a living wage. Now, in my story to why I'm leaving medicine, I was called into my manager's office because I wasn't prioritizing per protocol. She accidentally let slip to me that I have to prioritize certain groups of patients. This specific hospital had these patients called observation patients, but every hospital has a different term for them. I was told to prioritize the observation patients because their insurance pays better. So, as a result, they would get better care. It's a horrible thing that happens, and now I knew I was in a position to where I couldn't be fired as I was contracted, and the manager would actually get in trouble for trying to fire me, so I respectfully declined. She didn't really have a way to respond to that, and I was let back to work. That's right. Just because you're insured doesn't mean you'll get care. You will be one of the convenient corners the hospital cuts just to make sure they meet their bottom line. None of this can be fixed if the only incentive the hospitals have is to make money. If care for people is simply a service on offer and there are dollars to be made, then corners will be cut, because there will never be a point where care for you is the number one priority. Siphoning dollars away from you is the priority. In an ideal world, hospitals are places where care is provided to patients. And if you remember the history of medicine, they evolved out of a previous traveling doctor. That was the approach to medicine back then. Well, time's a flat circle. Let's talk about concierge medicine. This is another way hospitals are being drained of their trained staff. Concierge medicine, also known as retainer medicine, is a situation where a patient pays an annual fee to keep a doctor on retainer. In exchange for the retainer, doctors agree to provide care and commit more time to each individual patient. Now, if your first thought is, wow, that sounds so much better to being stuck in a corner cutting hospital with insurance companies breathing down my neck, asking me not to do stupid shit, asking doctors not to suture important organs, then yeah, great. You've identified a bunch of the problems inherent in the currently broken system. The insurance companies arguing whether or not you can suture an important organ that will save somebody's life is in fact something that we should consider fucking dystopian. If your second thought, though, was how much does it cost, you've identified yet another problem of a broken medical system. Good for you. Concierge medicine costs about $2,000 to $5,000 a year, on top of any other medical expenses you might have. So if you're already worried about drowning in medical debt, these doctors won't help you. And they come with a slew of other issues as well because, well, there's so few concierge doctors, you may be stuck selecting doctors who are actually out of your insurance network. Because, oh, by the way, that's still a thing we have to consider when looking at healthcare in the United States. You might not actually have the ability to get a healthcare provider because they may be out of fucking network. The only real benefit is that sometimes the concierge doctor can negotiate with you not to go to the emergency room over a text message. And that, sometimes, hypothetically, might save you money. But why do doctors leave hospitals in order to pursue the concierge medicine model? I thought hospitals evolved from that model and, well, we're supposed to be in the middle of an improvement over it. Well, it gets a little complicated. I want you to put yourself in the shoe of a doctor right now. You go to work, your pay is good, but you're severely understaffed at the hospital. So you end up acting less like a medical professional and more like a ping pong ball, bouncing back and forth between patients without being able to give any time to each of them, the time that you feel they deserve. You want to give better care to each individual patient, so you decide enough is enough. You leave your stressful job at the hospital for a more cushy job as a concierge doctor, going home to home, checking on patients and giving them the care that they need. But there's a problem. You are now part of brain drain, the term that is used to describe the departure of any educated professional who leaves from one area to another in search of better pay or living conditions. Doctors who participate in this brain drain process, either by entering the concierge system or leaving rural areas to seek better pay near cities, aren't the villains here. They're as much victims of a shitty system that's incentivized this behavior as the patients who lose access to professional care as hospital staff dwindles. The end result always looks the same, though. Higher healthcare costs for you and higher healthcare costs for me. Concierge medicine basically ends up providing a premium healthcare service for those who, frankly, don't fucking need it. It doesn't have any impacts on your mortality rate across the board, so it's not like this premium service is saving any lives by the numbers, and it serves to worsen the experience for those of us who are stuck in the shitty system, who have to frequent the hospital like the lowly plebeians that we are. And since that's really our only form of healthcare when we don't have a whole lot of money, we just strain that already dwindling workforce. Also, it turns out that the concierge model doesn't even provide more time and attention to those patients who are in worse health in the first place, because, you'd think those are the people who needed this kind of specialized care in the first place. To quote from a researcher's note from the study, if society prefers to increase healthcare access to people in worse health and those living in lower income areas, then concierge medicine harms equity objectives. Medicine for profit is an abusable business, where what should be a human right gets leveraged like a carrot on a stick, and premium versions of care are sold to the highest bidder, and participation in this broken American model is unfortunately mandatory for all. And for all the libertarians out there who just started typing away at their keyboards, don't worry. Maybe I'll make another video on negative and positive human rights later. For now, enjoy screaming into the void. Well, this was all leading up to something, right? Technically, this is leading up to two major conclusions, but we'll need to get the most important one out of the way first. What is corporate slavery? Well, it's a word that originated in Japanese work culture, and it means employees who are squeezed by the company as if they were livestock. In Japan, the term originated due to having a culture of, people working themselves to death, so to speak. A massive population that was willing to work and then work harder, then work more, then work overtime, and then give up so much of what their life could be in order to work just a little bit more. In short, you were expected to stay in a job as long as humanly possible and annually receive raises and promotions so that you could move up the management hierarchy. This is the honorable thing to do and a shameful thing to avoid. However, whereas Japan has statutory healthcare where 70% of the overall costs are all covered by taxes, and then your employer picks up some of that cost and then you pick up the rest, usually you're paying pennies on the dollar at that point. The United States has something different. We have opt-in healthcare with the history of problems that I've listed in previous chapters. So why do we also have a culture of corporate enslavement? Well, for many of us, it's for healthcare. You see, whereas healthcare prices in other countries, Japan included, are, heavily regulated, subsidized, and all that fun stuff. Here in the States, we just do the subsidization part. We have a free market system, and as a result, this has made healthcare unattainable for a lot of Americans. As a result, we look for whatever method possible to attain healthcare in order to be protected, since it is normally very hard to obtain it cost-wise. This is why so many employers actually offer a healthcare plan. They don't have to, outside of workers' comp packages that cover you in case you get a workplace injury, but employers realize that there is one surefire way to undercut an employee's pay while having them thankful for you underpaying them, and that is to offer a healthcare plan. Any healthcare plan. Now, it may seem like offering a competitive healthcare plan is a net positive, but it ends up being used as leverage for abuse more often than not. When I personally was working at McDonald's, we didn't have a healthcare plan for anybody who wasn't in management, but our district manager, who was aged well past his 70s, had to continue working day in and day out. Why? His wife had cancer. He couldn't spend time with his wife, taking care of her and supporting her in what could have been her final months, because 10 hours every day, if not more, he needed to be at work, bouncing between every McDonald's in our district, maintaining his position in order to keep the healthcare dollars flowing for her cancer treatments. A man who, by all accounts, should have been allowed to retire years ago, had to maintain his position as a wage slave, guiding other wage slaves, because the United States medical system is a for-profit industry with zero incentive to help people if there is no financial gain involved. This allows jobs to utilize the U.S. medical system as a leveraging point to keep people like my old manager on the hook even after they've aged so far out of their position that they should just be allowed to rest. After all, you wouldn't want your wife to go untreated while her cancer is ravaging her body, would you? Better get back to work. We've got a great benefits package that could help her. After all, you wouldn't want anything bad to happen to her, right? Medical insurance being used as leverage to keep employees past their time is only one of the problems with the system. There's just as many examples of workers who stayed in abusive working conditions because they, for one reason or another, just couldn't afford to work anywhere else. A quote from Forbes says that our findings suggest that many people would be unable to afford health insurance if it wasn't covered by their employer. They learned that nearly 1 in 6 employees actually dislike their jobs, but stay to retain their employer-sponsored health insurance plan. In fact, the risk of losing insurance deters 45% of employees from quitting their jobs to pursue self-employment. From this information, one could conclude that there is a large swath of workers who are generally very dissatisfied with their work experiences, yet feel trapped. There's a term for all of this. It's called velvet handcuffs. Velvet handcuffing is a term to describe any system where favorable options are granted to you, and in exchange, you don't seek freedom. In this case, healthcare through the employer. Your employer may engage in all manner of abuses, but you have velvet handcuffs on. And they're oh so very comfy. Why would you want to leave your employer and lose your health coverage? It's so convenient having it right there. Just stick around. Pay raises? We'll talk about that during the next year-end review. This means that not only do a large portion of the United States workers feel completely constrained by the need to have pay from their job, that part's fairly normal, but they actively choose not to go to similar paying jobs where their skills would still be valuable, because their employer they're currently with has them in a chokehold. Leaving work means being uninsured, and being uninsured, well, that means practically anything could happen. What if you get hit by a car on the way home from work? Surely you need medical insurance just in case something happens. Imagine the absolute anxiety of wondering if any day now your boss could terminate your employment, forcing you to rely on savings that you might not even have to survive between jobs, but immediately stripping you of your health insurance coverage on the spot. And because insurance is gained only during the open enrollment period in the United States, if this happens early in the year, you could be out of luck for an extended period of time. Oh yeah, that's another thing for those of you who might not know. Health insurance plans, you can only really enroll in them during the open enrollment period in November. We can buy car insurance, life insurance. We can get all kinds of insurance any time of the year, but health insurance, that you've got to wait till the markets open in November in a lot of cases. And that's fucking weird, right? Now, this is where we probably should talk about COBRA, that time where you're in between jobs. COBRA stands for the Consolidated Omnibus Budget Reconciliation Act. Ostensibly, it's supposed to support and kick in when you need healthcare coverage when you lose your job. if that job already gave you healthcare coverage. The basic principle is this. You had a healthcare plan from the employer and it costed you a certain amount of money out of your paycheck every month. Now that you're unemployed, why not just go ahead and have a certain amount of money come out every month so that you can still have health insurance in the interim while you're trying to get another job? You know, or you're waiting for the magical open enrollment date that we have for some reason. Now, in theory, this is a wonderful thing. In practice, though, the healthcare through your employer, well, they got a subsidy for that. They didn't have to pay a ton of money for that healthcare plan. You were buying into a pot, basically. Healthcare through your employer, well, your employer is the one responsible for covering most of those monthly premiums when you have job-based insurance, but once you opt into the COBRA system when you're between jobs, you are now single-handedly responsible for the entire cost of your healthcare premiums. This means that any subsidies that your job got, this means that any extra expenses that your employer paid, that they were using to make sure that they were spending that money there instead of in your own pocket, well, you're responsible for all of that now. Now, it may not cost you, say, $100 a month to get your employer-sponsored healthcare. Now it's something closer to $1,000. And of course, now that you're unemployed, how exactly are you covering those costs? I'm sure somebody can figure out the magic math to make money when you don't have any and just make it appear out of thin air. I mean, they're selling drugs. We did begin with the whole thing about Walter White. But the end result, in my estimation, is a system that says, we have a solution for you on paper, and then ends up being useless for most of the populace at large. But it does allow politicians to point to that system and say that a solution exists when you talk about issues in our medical industry. It's a non-solution, and it's a convenient scapegoat. Do you know what it's called when you have to ignore the shortcomings of a relationship in order to survive? Oh, right. It's called abuse. If you were in a relationship with a partner and they were paying all the bills and they became abusive to you mentally or physically, and your choices were freedom but starvation or sticking around and being hurt, well, we would say that a few red flags were raised immediately. People would question how safe you were, how much you were stuck, and how you could get out of a problematic relationship, what the power dynamics were in that relationship, why they were so scared against you that any choice you made would be the wrong one. But if this relationship is a business one, well, suddenly we turn a blind eye to the plight of the worker in the same exact situation. Workers staying in sometimes dead-end jobs because it's the only stopgap allowing them to have a measure of security for their health. Meanwhile, the mental and sometimes physical strain of doing so forces a further reliance on the medical system to keep them functional, thus creating a vicious cycle. I found myself in this exact situation years ago. I used to work for a company that had a stellar retirements package, a stellar benefits package. I mean, the fucking works. It also paid well on its own. I was making $40,000 a year, and that was 10 years ago, which was a really good amount of money to be making where I live, especially when you add the benefits on. However, due to a variety of personal circumstances, I manifested a debilitating anxiety disorder that began to make it difficult for me to do my duties as an overnight manager. I was also in a system that made me exist entirely as sick day coverage for other managers, meaning I had a different set of expectations from a different set of store managers every single night. I would get shuffled around every single place. This came with better pay, but it also came with a lot more stress. And I couldn't really move out of this because the store that I was based at didn't have an opening anymore because, well, I had vacated that opening to take this higher paying position. And then I was stuck. I couldn't move into any more stable position, so my relationship at the time that was in shambles, well, it created a witch's brew of instability that forced me to take several sick days. I also ended up on Klonopin, an addictive anti-anxiety medication that I was prescribed by my physician in order to keep me stable and working. Now, eventually I used too many sick days and began a vicious cycle of waking up, being too debilitated to go to work, and then being too debilitated to even call out of work again and again and again. And during my bid to get leave under the FMLA Act, which would allow me to keep my job, because the FMLA Act would allow me to have a few extra sick days so that I could make up for the extra days I had taken, Well, everything became too much, and I had to resign. This left me without work, and now without the medication for my condition, and a new habit of clutching a stuffed animal to my chest whenever it began to tighten, in order to keep myself even mildly functional between bouts of breakdowns. Now, maybe with time, I could have found some equilibrium, but with a limited sick day system, I eventually had to either use every last bit of my time to fight for FMLA, to possibly get denied, or resign, and thus annex one large stressor in hopes that it would let me stabilize. Now, it turned out that the right call was to actually just leave. That killed a lot of my stress. And shortly after that, I managed to slowly rebuild by getting a job at McDonald's, again, as a manager, with a more stable environment. Things started to calm down around me. I was able to operate without any need for my medication for a while, and the end result was plain for me to see in hindsight. I was reliant on my employer for not only financial survival, but for medical assistance. But my own employer was contributing to my medical ailments in the first place, which caused an unhealthy cycle with no good options. I could either stay in my job and let my mental health spiral into oblivion, which would cause me to rely more and more on medication to function, or leave. And leaving would gamble everything on the hopes that I would be able to make enough to function at all afterwards. And hope I would find a job that could not only take me, but would be able to adapt to my precarious mental situation. I lucked out. Many don't. Now, unions can help mitigate this problem by providing better worker protections, but unfortunately, they aren't enough at this particular moment to solve the actual problem. The medical industry as a whole and its for-profit incentives make any altruistic inclinations the workers may have not be enough to counterbalance them. Outlets to allow the abuse of employees through wage slavery is only half of the issue, though. And I mentioned that there was another one. So, let's talk about eugenics. Let's first get a definition out of the way. Eugenics is the study of how to arrange reproduction within a human population to increase the occurrence of heritable characteristics regarded as desirable. This system was developed by Sir Francis Galton as a method of improving the human race. Eugenics was increasingly discredited as unscientific and racially biased during the 20th century, especially after the adoption of its doctrine by the Nazis in order to justify their treatment of the Jews, disabled, the Romani, and other minority groups. Interestingly, in this definition of eugenics that we have just ripped from Google, you'll notice that it includes how the Nazis treated disabled people as one of its examples. Now, there is a history to the eugenics movement in the United States. Did you know that the Nazis' own eugenics movement was actually based off of the bones of the United States' own eugenics movement that they were enacting in their own population? In the 1880s, Sir Francis Galton promoted the idea of being well-born. This meant that somebody had won the genetic lottery and would live a happy life. It would also basically mean that somebody was born into wealth and nobility, and eventually people just being born to whichever race was currently politically dominant at the time. This wasn't some natural evolution of an otherwise scientific theory. Dalton specifically studied nobility in Britain and came to the wacky conclusion that those in the aristocracy of the United Kingdom had basically been born with superior genetic makeup, thus causing them to be deserving of their status as nobles. He also wrote a letter to the Times explaining that the biggest problem with China wasn't their genetics, it was a series of failed dynasties, and therefore they should take their superior genetic makeup and go colonize Africa and displace all of the unsuitable brown people there. So maybe racism was kind of baked into the idea of eugenics all along. American eugenicists, as it turned out, largely believed that the white population was the most deserving for American soil, and thus supported strict immigration laws that restricted which races could breed, and supported the forced sterilization of the poor, disabled, and whomever the church at the time deemed to be immoral. Now, you notice that the Nazi Party basically did the same thing, just with a much heavier hand. They took the bones of our eugenics movement and built an entire political movement on top of it. In this essay specifically, we're focusing on the poor and disabled, but if we look at the history of the DSM, we can see how certain things the church has deemed immoral, like homosexuality, have actually been considered disabilities in the past. So it's not like that skeleton of supporting eugenics is getting any less bigoted anytime soon. When we think of eugenics today, you may think of an attempt to violently eliminate, quote, undesirables, unquote, from the populace. But in fact, there's another far more invisible method to eliminate undesirable people from a populace. You simply let them fade away and disappear. You let them slip through the cracks of society until they eventually die. Now, you see, in reality, ignoring problems doesn't usually make them go away, but if the problem is a populace of people who don't have enough money to afford medical care, ignoring them means they will slowly go away. They die. They become unable to thrive due to a lack of medical care. In this case, ignoring the problem does, in fact, magically make it disappear. Don't believe me? Let me read you an excerpt from ABC News. This is from an old political debate. CNN moderator Wolf Blitzer's hypothetical question about whether an uninsured 30-year-old working man in coma should be treated prompted one of the most boisterous moments of audience participation in the CNN/Tea Party Express. To quote, "What he should do is whatever he wants to do and assume responsibility for himself," Paul responded, adding that that's what freedom is all about, taking your own risk. This whole idea that you have to compare and take care of everyone. The audience erupted into cheers, cutting off the congressman's sentence. After a pause, Blitzer followed up by asking, "Congressman, are you saying that society should just let him die?" To which a small number of audience members actually shouted, yes. This is a contingent in America that are so deluded that they believe that the chronically ill can just care for themselves. In this case, they were talking about a person in a fucking coma. They believe that they can just care for themselves without any kind of assistance whatsoever. And these same people inevitably end up feeling that if you're too poor or too infirm, then you're much too much of a burden on society and you should just expire. In the minds of these kinds of people, the undeserving people get their just desserts. They die. And then society progresses forward, thriving better as the weak have been culled. The weak in this case are always poor people. Disabled people, sick people, people who've landed in a bad situation thanks to the lottery of life. People who haven't done anything so wrong so as to deserve simply to expire when they have treatable conditions. And even when they don't have treatable conditions, we can still take care of them because they can still end up contributing in other ways. Stephen Hawking comes to mind. These people never consider how much those who need help in this moment could offer help to the next generation of needy in the next moment. They, or maybe even you, don't consider what happens when the needy person is a parent who spent every penny trying to raise you, a grandparent whose pension or 401k fell through, a child with a chronic condition they've had since or near birth. And these people most certainly don't consider what would happen if the person in need one day happens to be them. Much like how the Nazi Party didn't consider the disabled people deserving of real medical care and they let them die, our country is very much trying to do the same to its poor. Instead of thinking of each person as in need of care, as well as an untapped well of potential that just needs a hand, our country thinks of those people as parasites, undeserving of pity. An older gentleman who's given his life in service to the United States labor machine, unable to afford medical care because politicians try to strip Medicare and other healthcare opportunities from him, a child unable to begin working because of a treatable illness or condition, continues to financially strain their parents, and yet people cheer on their eventual death for one reason. They're invisible. They're invisible. These people are invisible until they are made real for you. The United States healthcare system is engaged in a form of eugenics by allowing poor and disabled people to die rather than give them adequate treatment. It discriminates against these groups of people, effectively privileging wealthier individuals by default over economically disadvantaged or disabled people. When access to good healthcare is based on wealth and is treated as a commodity rather than a right, people without financial resources become unable to access new cutting-edge treatments. Specialists and comprehensive holistic care, that shit goes out the window. This leads poor and disabled people to be unable to afford even basic care, often relying on the emergency room in times of dire need, then being unable to get themselves out, burying themselves under piles and piles of medical debt, creating vicious cycles that I've been going on and on and on about, needing more and more medical care the sicker they get, and being financially burdened. They need to pile on more and more work in order to try to get out from this debt, but that infirms their bodies even more. Eugenics, at its core, is an attempt to improve the genetic quality of a population by culling and discriminating against people who are seen as undesirable. When poor and disabled people are seen as undesirable, ignoring their medical plights directly leads to an increase in their mortality rate. And if you are directly engaging in actions that lead to an increased mortality rate for a certain portion of the population, well, you can do the math. We call this stuff out in history because we can see the writing on the wall when it's in hindsight. But when it's happening directly under our noses, that's just the system working as intended. When the U.S. healthcare system works as intended, people die. Plain and simple. Ask yourself, whenever you see a system, ever, what is the outcome of that system? I would argue that the outcome of a system denotes its purpose. The purpose of any system is what it does. The United States healthcare system doesn't really help people all that much. It actually just kind of indebts them more than anything. So that must be its purpose. But on a personal level, ask yourself, why are you okay with people dying when it could be prevented? Why are you okay with chronically ill people suffering years and years and years, hoping for some kind of relief? Hundreds of thousands die due to negligence that is baked into our broken system. Why do any of us tolerate a system blatantly involved in a passive form of eugenics? Oh, by the way, it's not just CEOs. You can't just shoot the problem away. It's not just the people in power who think this passive elimination of our fellow human beings is okay. Here. There's a Reddit post where they said, we spend too much on people who never try to find work for themselves. If they work hard and find a job, then great. If they starve and die, then great. They won't have kids, and that ends the cycle of poverty. Their version of ending the cycle of poverty is the elimination of a bloodline. Tim Corbett's rejection of the medical expansion under the ACA, the Republicans are proving that their prescription for healthcare for the poor is to simply let them die. And to think, legend has it, that Marie Antoinette lost her head over her ignorance of the poor's needs to eat. Corbett has a history of slashing healthcare funds targeted for low-income families. And this idea that we can just let people age themselves out of a system to die, the fact that we can just let them eventually just expire, it's not new. This has been around for a long time. Here's a quote from Dr. Giovanni Bianchi who lived in 1693. He was one of the great Italian doctors of his time. The doctor had no doubts. He was convinced that it was futile and unjustified to treat poor people and to admit them into the hospital. No one should have to invest medical knowledge, labor, and money in the poor. He was satisfied in asserting his thoughts, especially in his writing. The doctor should let the poor die and to only take care of people of rank, nobility, or wealth. This is an idea from centuries ago. Some conservative think tank has even given us the fun phrase, we need to accept the principle that sometimes poor people will die just because they are poor. Oh, by the way, what's the fourth leading cause of death in the United States? Poverty. The evidence is clear. The United States healthcare system is one cog in a giant machine that is meant to eliminate poor and disenfranchised disabled people. Not through direct action, but through basic negligence. This entire medical system may not be designed specifically for harm, but that is baked into its bones. A passive eugenics of class is baked into its bones. Oh, and by the way, eugenics doesn't have to be an active process. It doesn't need to have hostility baked in. It merely needs to have the end result of elimination twisted into its design. If you're watching this video, ask yourself this. Is your medical care covered by government subsidies? Is it provided by an employer? Do you even have medical insurance? In any of these scenarios, remember that it is the system working as intended. Government subsidies allow a broken system to continue operating in its current capacity. And hopefully, you never lose any legislation that actually allows for these subsidies to cover your care. If you're covered under an employer, ask yourself, why should that be the norm? What business does your job have in controlling your health care and whether or not you get to receive medical care? What abusive behaviors have you excused because you needed that job? And if you're not even covered, why shouldn't it be the responsibility of the taxpayer dollars that you have already spent to enrich your own health instead of some pocketbook for some fucking politician? And finally, in any of these scenarios, should we tolerate a system that can just delay our coverage, deny our claims, and eventually force us to defend the basic idea that each and every one of us deserves the right to exist? I can imagine, if you have even a fraction of empathy, that you're likely livid at this point. You may even be so upset that you're motivated to go do something about it. Well, I have good news. There's a few options, but it's going to take a lot of work from all of us. Let's go vote about once every 4 years and hope for the best. Obviously, I'm kidding. You and I both know that's not going to fucking do the trick. But maybe you thought that voting was all you needed to do to participate in democracy, and if that's the case, then I understand. It's not like our school system told you much more than that. But let's go over a couple of options. There is the vigilante route. I'm sure you've thought about that. You've seen it on the news. But let me go ahead and dissuade you from that particular one. Not only can I not endorse actions like those allegedly taken by Luigi against the United Healthcare CEO on this channel, there's also great personal risk involved for you, so we should basically avoid violence whenever it is humanly possible. Violence is really only useful when it shows who needs to be harmed, but harm needn't always be violent. Harm can be caused through non-compliance with the system. As an example, let's say you don't like that there are self-checkouts taking jobs away from your grocery store workers. Will violence solve this? Probably not. But will harm solve this? Oh, absolutely. If enough people stall at the self-checkouts such that they become more expensive for the company to run, more expensive than just hiring workers, eventually the company is left with two choices. Hire workers to check people out so they can continue their revenue flow, or install more self-checkouts, which will only work until people stall those machines as well. So let's talk about methods that we can use from within this system that we have to live in, starting from the easiest, instead of just voting. Maybe you should get involved with your local political party. That would be pretty easy. You can usually find links to your local party on like Facebook or asking around in your voting centers to see when and where they have their meetings. This gives you a direct line to candidates, by the way. I've spoken personally to Sean Harris, who is running against everybody else for District 14 of Georgia. These people who are going to represent you during the election cycle, well, you get to talk to them. You can communicate to them directly and tell them what your needs are and the needs you think aren't being met. This direct involvement cuts through a lot of the fat that a politician usually will use. Politicians like to lie to their constituents a lot. But it's a whole lot harder when you're, right fucking there in their face, questioning their policies every day. Questioning the policies that they've written, the statements that they've made, being directly involved with the people who are operating their campaigns so they are beholden to you to a degree. You can have a much more direct impact on how their platform is communicated to other people in your local area. That's another thing you get when you do that. There's a lot of power in being able to control messaging and being able to hear the reasoning for that messaging directly from the source. You can go to your local meetings, talk to people who are directly involved in your politics, communicate your needs, ask things like, do you need more cancer coverage? Do you need an option that allows your child to have health care without joining the fucking military? What exactly do you need? Go to your local rep, Go to those meetings and talk to not only them, but everyone else at the meeting about what needs you have that aren't being met. You'll find that so many of the people around you actually have similar needs, but a lot of us aren't really good at voicing them. Now, this method is not the easiest. You may have to go out and canvass and phone bank, or otherwise engage in human interaction over and over and over again, but it is the easiest of all the methods of involvement that I'm going to tell you. It gets more difficult when I suggest this next addition to the previous strategy. Write the fucking law yourself. I'm serious. Go to your congressional website and look at the language of recent bills that have been passed, and then sit there and try to replicate that. Don't use AI. Stop. This is no different than any writing assignment that you would have gotten in the 3rd grade. Trust me, you can write a bill. It's not the hardest thing in the world. Write out what specific needs you have in the form of legislation, then present that to your local candidate. You'll find that there may be some fine-tuning required to make sure whatever you've written down is feasibly presentable, but you'll also find that doing 90% of the work is going to yield a lot more results than just bitching about things that you say you need. The only method that you can use to help speed things along to a better future is to form a union, though. You could join a local union of workers as well. That would also help. This method tends to be fairly effective because unions have a lot of bargaining power against their companies that they are part of. There's even legal protections in many states for union members, preventing them from being fired so that it's easier for them to maintain health care and do things like, go on strike when an employer is no longer fulfilling the needs of the workers. There can also be inter-union strikes that are planned when you can shut down entire industries until certain basic needs or demands are met. Needs like better healthcare packages, better hours, better pay, any number of things that you've needed from an employer and may have been denied. Starting a union can be really difficult, though. If you're working at a place like Walmart, for instance, they have a lot of anti-union propaganda that will guarantee that any workers you try to communicate with will already be against you when you try. Many people aren't informed about the protections that unions can give in the United States, so the fact that no company can truly fire you from a union usually is also something that's not talked about. Now, places like Walmart, they have plenty of sleazy methods to try to tell you that you can't form a union or dissuade you from doing them. That's just a thing that they like to do. A lot of times they'll actually just shut down an entire store if you successfully form a union. The CEO did do that once. That's happened in the past. This is an unfortunate reality of the borderline hostage situation that employers can put you through. Advocating for our needs up to a certain point can be considered so threatening to the bottom line of capitalists that they're willing to cut us off, despite their own face. But this is why it's so important to engage in that workers' rights advocacy in the first place. Companies like Walmart wouldn't be so scared of unions if unions weren't as effective as they are. We also need to get doctors unionized. Now, it may seem weird to some of you that a class of people who make as much money as they do in the medical industry should be unionized in the same breath as workers who can barely scrape about on $20,000 a year. But by unionizing the medical industry, by unionizing pharmacists, nurses, doctors, surgeons, we can actually start having a network of medical workers who are willing to organize against predatory practices of insurance and hospital CEOs. There are rules that make surgeons take less risky procedures, that deny insurance claims to those in need, that twist the practices that doctors engage in based on income. These things only have power so long as they have hierarchical control over those doctors, those pharmacists, those nurses, those surgeons. Unionizing industry works, guys. That's why there's so many people who fight against it. And by the way, we're just, in general, infinitely stronger together than when we're ripped apart and atomized and isolated when we try to advocate for ourselves. So that's two methods. One from within and one from without. The one from within involves getting directly involved in your local politics so that you can slowly try to change these local policies that allow the healthcare industry to strangle you the way it does, and unionizing, which is a method from where you can also advocate. That's a method from without instead of within, for the best possible package that you could get within this broken system. But there's another method you could use. The online activism model. Not fighting in the fucking comment section, but starting a YouTube channel. a podcast, making a video game with commentary on this system, literally raising awareness for the current system's inadequacies, by definition, is doing something. There are methods of trying to do this that are completely inadequate. Like I said, arguing with people on Twitter and YouTube comment sections isn't going to do a whole lot to sway hearts and minds, but if you can learn enough about search engine optimization to get your ideas out there, well, enough of us being loud enough can change enough minds so that maybe the next generation can get a little more directly involved in a way that can help shape our future into something a little more livable and a little more fair for all of us. After all, we are deep in the information age, and there is no reason why information about our individual stories shouldn't be able to reach millions. That's why I've included stories from those who have had specific issues with the medical industry throughout this video. Here's another way to help out. Protest. And not just going out and protesting, but providing care and sometimes even housing to people who are protesting. People who are on the front lines trying to raise awareness and advocate for your rights. People feel very often that it's always someone else's job to yell at a senator at their Capitol or go out and stand on the picket line, but it can be just as important to provide necessary and lacking infrastructure to the protesters who do what they do in the first place. Not everybody coming in to help raise awareness is from your local town. I've protested out of town plenty of times. That's okay. All in all, I know this feels like a lot, and I know if you've sat through this entire runtime of the video, it seems like I'm just throwing a bunch of potential solutions at the board and hoping something works, but the truth is, every level of solution is required. Huge acts that raise awareness, from protests to memes and small writings of things and making the laws yourself, a lot of it is required. A holistic approach is required. And I think we should all be able to agree that we're past the time of not advocating for ourselves politically. To our families, to our friends, to those that are supposedly closest to us, we should no longer be atomized politically and unsure of each other's beliefs. We should be working together for each other's benefits, because ultimately that leads to a better reality than the cruel one we've all been born into. I think at the end of the day, we can also agree that our medical industry is killing us, and that is by design. But that means we can pull some of the levers of design ourselves to change that. It needn't continue to be this way. Things can be better. We can make them better. Let me know in the comments section what you'll be doing to help speed things up along in the future, so that one day we can have healthcare rights that we deserve. Until then, though, I'm going to keep doing what I'm doing. I'm going to be here as long as I can, doing what I can. I also want to include one more story at the end of this video. I want to leave you guys with one more story from somebody who has helped me out of a bind before, who has dealt with a lot of nightmares with the medical industry to close things out. And maybe wish him well in the comment section at the end of this. This is my friend Peter, and he's helped me out of more than one jam in the past. And this is his story.
Hello there. My name is, well, most of you know me by Swede. I'll not give you my full name, as it were, but to kind of give you a little history of medical care in the United States and how it's affected me and my family and those around me. So, as some of you may or may not know, I have survived 2 ascending type A aortic dissections. I have also survived a transposition from my carotid to my left subclavian through what I thought was a bypass procedure, but it is not. So first procedure was in 2020. Second was I had my gallbladder out in 2021, which was an adventure in and of itself, because due to being on blood thinners, I had to be in the hospital for 2 straight weeks to ramp me down and then back up again off the heparin drip. And then on top of that, I survived my second one in 2022. And then the transposition to correct a major error that was causing an aneurysm was done in 2023 in January. So over the course of 3 quick years, really had 4 major surgeries. 2 of which were open heart. The transposition was just kind of a quick go in right here. I think it was about a 3-hour procedure. Luckily enough, I had Dr. Caselli down in Houston do that surgery. He is known as the world's greatest. We had to fly down, obviously on our own dime to do that, and we were fortunate enough to be able to do that. But it's when you can get to the best, you do that. And he was nice enough to fly back from a conference from Milan to do my surgery. Now, obviously the biggest thing was getting the bills from all of these, and the top line cost of all of these. The first surgery was about 1.2 million. The gallbladder surgery was 10,000. Even though I actually had a hospital stay for 14 days associated with that. The per diem was not very much on that because I didn't require a lot of care. It was just a heparin drip and my daily dose of drugs. And then the second surgery, surprisingly, was less expensive. It was about 750, 800,000, if I remember correctly. It wasn't over $1 million. I know that for sure. And then the transposition surgery, I know, was with all costs included. This, the payment to the hospital was about 85,000, and then cost to get down there, hotel stay, and everything else, along with all the checkups and CTs and everything else that had to go with it, came out to be about 100,000. Now, obviously, all of that's not out of pocket. We've hit our out of pocket maximum every year on top of all this. So, and then we've in 2022 and in 2021, we had to deal with both my kids breaking wrists on the playground at school. So we've had to deal with casts and everything else that you normally have to deal with as a parent with, kids in elementary school. So, it's roughly $10,000 to $20,000 a year out of pocket for all these things. And to give you some bit of, thought, my wife and I are in the top 5% of wage earners. I originally thought we were in the top 2%, but apparently that number's moved. And we're in the top 5%. I'm not going to give you an exact figure, but $20,000 a year is $15,000 to $20,000 a year is still $15,000 to $20,000 a year, and that's a tough nut to crack. The annual cost for all of my drugs, all of my procedures. I have to have a CT and an echo every year. My youngest son, who got the same genetic condition that puts him at risk for all these things, also has to go through an echo every year. And is on drugs, even at 5, 6, 7 years old. So, we've got a lot to deal with in that. And then on top of all that, there was the genetic testing, which cost roughly, about $1,000 after it was all said and done. And that covers me and my 2 kids. So, once they find it in you, your kids are free to test. Ooh, they make it sound like they're doing you a favor, but really they're not. Now, the problem with all this is that I should have been tested when I was 19, but I wasn't a classic case. My pediatrician wanted me to have a genetic test in 1998, but at that time it would have been a $5,000 out-of-pocket, thing. That would have saved a whole lot of heartache between, then and now. I would have had a prophylactic surgery. I would have had monitoring. I would have had everything else, and it would not have cost over $2 million to keep me, where I am today. So, think about where we're at and how much that costs. Even with being in the top 5% of wage earners, we've had to cut back on retirement savings. We've had to cut back on, a few other things. We've had to cut off a few vacations, not just because I couldn't make it, but because, financially we're just not there to do that. So what kind of healthcare in this world do we have that someone as privileged as our family is has to make significant sacrifices due to being, keeping their dad alive? And then also making sure my son has, proper care. So, I'm blessed to have been even, survive what I went through. The survival rate of what I went through, according to the doctors, I'm 1 in a billion. There's a handful of people that have survived acute type A ascendings in the arch with a herniated aorta at that. It just doesn't happen. And I know how fortunate I am there. I know how privileged I am to be where I'm at with, my career and everything else. But at the same time, I would happily pay, 3-4% more in income, straight up income tax, flat tax, to make sure nobody has to sit around and wonder where they're going to come up with another 25 grand to stay alive. Because, the median family makes $70,000, $80,000 a year. And that's before taxes. So after tax, they're qualifying for the 7%, credit. But geez, that's just too much to put a family under. And so, that's what radicalized me, if you want to know. Long story short. So, thanks for your ear. And if you have any questions or anything, I'm happy to be part of Suris's, long essay. And, we'll hopefully get some good lobbying out of this. Thanks.
Hey, you made it to the end. I want to give an extra thanks to the patrons who allow me to do this full time. I want to thank Aaron Rail, Astral, Britzkrieg, Jemshin, Poundini, Red Joker, Victoria, Jonas, Craig, Tarika, Fireshard, Smiling GM, John, Dren Hadamada, Creeper, Sagitta, I'm not saying that last part, Sylvie Snow, Valis of Seraph, Ottoman Angel, Rooster Rachel, and Fire Panda, who are all my $20 and up patrons.